right now we get into our segment, which is the health segment, because today is a Tuesday and our topic of conversation today is Fit for Purpose Health Workforce. And joining me for that conversation is none other than Dr. Kelly Oluoch. He is the CEO, Kenya Medical Training College, that is KMTC. Welcome to the program.
Thank you.
All right, if we may just begin by first defining what we are about to get into, and that is the Fit for Purpose Health Workforce. When we talk about Fit for Purpose Health Workforce, what are we talking about?
Thank you so much. The vision of Kenya Medical Training College is to develop fit for purpose human resources for health through transformative training, research and consultancy services. We look at the issue of fit for purpose through the lens of quality that we are supposed to be able to produce at Kenya Medical Training College. And therefore, we would want to ask ourselves, who then defines quality? Quality is defined from the lens of the consumer, from the lens of the client, the employer, and the general public who receive the services of our graduates. So to us, quality is defined in terms of, is our graduate able to perform the task that they are being trained to perform? And we look at Kenya Medical Training College, our vision being a competitive institution in training human resources for health. In terms of global market, are we able to provide training that meets local expectation of a human resource for health? Are we able to provide training that meets the needs of foreign markets that also consume our services? Kenya Medical Training College graduates over 22,000 graduates every year. And that means that as an institution, we provide over 85% of human resources for health for the country. And the surplus, we are then able to support other countries that require human resources for health. And for us to be able to meet the expectations of these countries, our graduate must be able to speak the language of the patient in that country. And therefore, Kenya Medical Training College has invested in producing curricula that enable our students to learn French, to learn Arabic, to learn German, to be able to prepare themselves for entry exams that now, because of collaboration, is being offered locally. That is the NCLEX examination for entry into the markets like USA, Canada, Germany, New Zealand, Australia. We have made sure that our graduates are then able to work in any country of choice by ensuring that they learn these foreign languages from 5 to 11 p.m. in the evening. And therefore, by the time they are graduating, they are now ready for to provide services in the marketplace, whichever place they choose to work.
And right now, maybe what is the role of KMTC when it comes to universal healthcare? What is your role as an institution on matters universal healthcare?
Universal health coverage means that any citizen is supposed to access healthcare in a convenient way that does not have catastrophic effect on their financial position. Kenya Medical Training College has customized its training to take care of the broad spectrum of healthcare. In healthcare, you look at preventive services, you look at promotive services, you look at rehabilitative services, you look at curative services. Kenya Medical Training College therefore has customized its programs to address all this spectrum. By the way, Kenya Medical Training College offers 98 courses, and these courses are supposed to address challenges of the community at primary healthcare level, challenges of the community in rehabilitative care, mental health, curative services, and other services that are needed for a whole spectrum healthcare. So Kenya Medical Training College therefore addresses the needs of the community. Every single day, KMTC students, together with healthcare professionals, access over 450 health facilities in the country. Additionally, our students work at community level. 70% of our training is practical oriented, meaning that our students are supposed to access practical sites that are inside the communities at local level. Therefore, making sure that in addition to the efforts that our qualified health workforce are providing, KMTC students under supervision are able to provide and support the efforts of our counties, the efforts of the Ministry of Health, and make sure that we have a healthy, productive population.
All right, SHA, which is the Social Health Authority, has just been rolled out. It's quite new in the country still. So maybe what are you doing in ensuring, or rather on civic education, specifically in the grassroots levels, in ensuring that, you know, people are aware of these new reforms?
About rollout of SHA, KMTC has been tasked to work together with the counties of Kisumu and Homa Bay. In these counties, what we've done is, number one, we have set up information desks in our campuses. In Kisumu County, the college has 3 campuses. In Homa Bay County, the college has 4 campuses. In all these campuses, we have information desks. Number 2, we have formed a team of people who work in our institution, the SHA, the county government, and the national government officers working at county level, so that we're able to work together with community health promoters, chiefs, to be able to register all the citizens who reside in these counties, to support in their registration to be members of SHA. Last week alone, KMTC conducted 2 medical camps, one in Oyugis and another one in Homa Bay. And in these medical camps, apart from community diagnosis and treatment of ailments and referrals, the major activity in these medical camps was to pass out the information about registration of SHA and the benefits of SHA compared to NHIF that we have been running on. In addition to that, our institution has a properly managed communication department. And therefore, through this communication department, we pass out information on registration, access to registration avenues, and need and frequently asked questions being taken care of, to make sure that all those who have any challenge in registration are supported in this teamwork, to make sure that everyone is registered under SHA.
And as someone who is a stakeholder in health, you know, maybe what specific skills do you feel are currently lacking in our health workforce at the moment right now?
We have, in the recent past, noted that there is need to step up skills on medical insurance. So Kenya Medical Training College has formulated a course together with stakeholders on medical insurance, graduates of which are then supposed to work in SHA to support in claims management and pre-authorization of those who need support, and also to make efficient services offered in SHA. Additionally, there is a gap in community level, in that we have CHPs working at community level, but we also need other professionals at this level. We need community health assistants. We need nutritionists working hand in hand with community health promoters. We need health promoters. We need public health officers. And therefore, Kenya Medical Training College has formulated courses that address primary healthcare needs of the country. The biggest challenge that the country may face is cases of self-referrals, where cases or ailments that could be managed at lower levels are managed at very high levels. SHA has come to address that challenge. But even as SHA addresses that challenge, there is need for information at community level about choices of food to eat, about hygiene, about self-care, physical care of an individual, and health-seeking behavior at community level. Understanding that information given at primary healthcare level and at household level is capable of preventing a lot of challenges that may arise later. Yes.
All right, so maybe what strategies can we implement as a country to improve retention rates among healthcare professionals? You know, because you had mentioned earlier that right now we train, yes, healthcare professionals right here in the country, but they don't just deal with the local people. Most of them go outside to try and get greener pastures. So what can we do in order for us to just try and retain, you know, professionals in the healthcare sector?
Thank you for that. Number one, the economy depends on, number one, the health workforce producing locally, and also what we would call foreign remittance, like foreign currency. So there must be a healthy balance between those leaving the country to find jobs abroad and those retained here to work in the local economy. One thing that we must demystify is that people leaving the country to work out of the country means that there is no one left behind to work here. KMTC produces over 22,000 graduates.
Really?
That is a lot of labor. And the local economy is well catered for through this level of production, because we take care of all the spectra of healthcare. So what needs to be done is proper collaboration in production of human resources for health between the counties and Kenya Medical Training College, so that we are able to make sure we can predict human resource needs of every county, to customize our production to meet those demands. And at the same time, we need to work closely with counties to make sure that the work environment for health workers is properly addressed, to make sure that as much as possible there is sufficient availability of resources at county level that enable health workers to work locally. What motivates health workers, apart from salary, is an environment that supports their services. For example, availability of drugs, availability of equipment, availability of sufficient health workers to prevent burnout, and being able to work in an environment where their training needs and self-improvement are addressed. So this should be addressed together to make sure that we have a motivated health workforce, in addition to what we are doing to produce sufficient human resources for health.
So it's not really alarming for us as a country
we
when have most health workers, you know, opting to go abroad to practice.
Currently, as we are, KMTC has over 67,000 students in the process of training. This year alone, we are going to produce over 22,000 students. That means that as a country, at mid-level training, we are producing enough for local consumption. But at the same time, a health worker upon graduation, within 1 year, should be gainfully employed, either locally or out of the country. And what we are doing is to give choices to our graduates to be able to either work, get absorbed locally in the workforce, or those who may not be able to get absorbed locally, instead of not being productive in the economy, be able to get a gainful employment for which they are able to give the country foreign remittance, and therefore make our currency stronger, make our economy great, make sure that by remitting to our country, they're able to make sure that those they have left behind are also able to get engagements that are gainful in terms of employment. Yes.
All right. Earlier on, you had touched on community health workers and how important it is to be able to also work hand in hand with them, you know, on in the community level. Now, when we talk about community health workers, how equipped are they? Are they well equipped? And if they are, maybe what are some of the cases that they are able to deal with?
There are over 103,000 community health promoters in the country.
103.
Over. So what it means to equip them is first in terms of skills and in terms of kits and in terms of mobility. What the government has done is first to train community health promoters. Number two, to be able to work jointly between county governments and national government for a reimbursement that then enables them to be motivated. Third, they have been provided with kits that enable them to go into the community and provide services at community level, basically at household level. Basically, what community health promoters do at household level, number one, is providing information. Providing information in terms of hygiene, which is very critical for prevention of ailments. Providing information about lifestyle in terms of appropriate amount of exercises that somebody is supposed to do. Providing information about mental health. And what then should one look for in terms of challenges in mental health? They also provide information about prenatal care, mothers who are expectant, accessing health facilities, the number of visits. They follow up to make sure that mothers who are expectant in communities access prenatal visits, which are called ANC visits, so that they are able to make sure that they are taken care of before delivery and any challenges are detected or complications are detected prior to delivery. They also make sure that expectant mothers deliver under a skilled healthcare worker in a facility that is able to support in case there is an emergency. They then also, today we have World Hand Washing Day. It is very important for the community health promoters to educate households on the importance of hygiene, making sure that we have clean environment, surroundings of homesteads being clear, bushes being cleared, making sure we are not having stagnant waters, making sure that we eat healthy food. All these are services that community health promoters provide at community level. In addition to that, there are those chronic illnesses like hypertension, like diabetes. There's need to make sure that there is frequent monitoring of indicators of heightening challenges that then community health promoters are then able to give information as to whether there is need for seeking additional care. So community health promoters have come at the right time, because if you're able to address and arrest health challenges at primary healthcare level, you're able to save a lot of resources that would have otherwise gone into curative services. It is said that if you spend $1 at primary healthcare level, you save $9 at higher levels of healthcare. And that is what community health promoters have come to do, to address these challenges that the country has chronically faced.
Yeah. And they do play such a huge role. I have to agree with you on that. Now, there's a research that shows, according to the Kenya Health Labor Market Analysis of the year 2023, Kenya has doubled its health workforce in the last 10 years. So maybe what have we been doing differently for us to get such results whereby we have doubled? So what are we doing differently, and maybe what more can we do in order for us to ensure that our healthcare is top-notch?
What we're doing differently is to improve access to training. In 2013, KMTC had 28 campuses. And at that point in time, the institution was graduating close to between 4,500 to 6,000 graduates annually. Over a span of 10 years, the institution now has 86 campuses and 6 satellites. We are graduating over 22,000 annually. From 4,500 to 22,000. That is a big leap in terms of health workforce. Remember, it takes a lot of investment to make sure you have a qualified human resources for health. Secondly, we have collaborated with counties. Today, during World Hand Washing Day, we as Kenya Medical Training College are joining the county government of Machakos for a hand washing day. That is a practical example of collaboration, so that counties are able to invest in KMTC. Another issue is the CDF, National NGCDF resources. KMTC has worked very closely with members of parliament to invest in the infrastructure of Kenya Medical Training College. The institution has moved from a net asset of around 7 billion in 2016 to a net asset base of over 32 billion because of resources that has been injected in the institution from counties, from NGCDF, and from other stakeholders. So we have heightened the level of collaboration with counties, NGCDF, and other stakeholders. We have also made sure that we have not been limited to local partnership. We have partnered with other institutions out of the country, like we partner with Edith Cowan University in Australia. We partner with Richardson clinics in US to make sure we improve on our curricula, so that we make sure that the people we produce are it's called Jackson Foundation in US, so that we're able to produce qualified human resources for health. As we talk right now, we have a collaboration with United Nations organizations to make sure that we have given access to refugees in Lodwar to train at our campus there on enrolled community nurses. These are completely funded by UN organizations. so that we are able to provide those services. This collaboration, therefore, makes sure that locals in Turkana County also access training at Kenya Medical Training College, and they are funded for that purpose. Another thing that has worked to make sure we have heightened or increased human resources for health is availability of Higher Education Loans Board funding for our students, so that our students are able to access, just like university students and tertiary institutions, financing that enable them to go through our training. Again, we've partnered with other local organizations to access bursaries and sponsorship for our students, like Ratansi Foundation, and we really want to thank them for that. County governments and CDF also sponsor students to come to Kenya Medical Training College. That way, we've also had an increase in the number of courses that are being offered and the number of students at Kenya Medical Training College. Additionally, we have had increase in the number of courses that we provide at Kenya Medical Training College, currently providing 98 courses in 18 departments and 7 faculties. That means that there is a varied amount of choices that people who want to train at Kenya Medical Training College can access. And then another thing that has increased our capacity to deliver in terms of numbers is embracing e-learning platform, e-library, and what we call ERP, that then enables learners to access learning materials remotely, even as they work in their environment. So, for example, higher national diploma programs, some of them, learners don't need to leave their work environments permanently to be at KMTC. Partly, they are able to access their learning materials online, and for a short period of time, they're able to come to learn practical elements of those courses at Kenya Medical Training College. So that level of flexibility has given the institution the capacity to provide and admit more students in our courses, and therefore that means that we have been able to step up the number of graduates that leave the institution in a way that we are able to take care of quality, we are able to take care of the demands for local human resources for health, and even have surplus that we are able to give to other countries.
As we almost come to a close of this conversation that we've been having on Fit for Purpose health workforce, maybe just how emergency ready are we? And by we I mean the doctors in practice, the nurses in practice, you know, people in the health sector who are in practice at the moment. Just how emergency ready are you equipping them to be? For example, right now as a country we are dealing with an emergency that is the Mpox. So just how ready are we when it comes to emergencies?
The COVID-19 pandemic taught the country the need to be ready. And as Kenya Medical Training College, we have almost always preempted need to be ready any day, anytime for challenges that may emerge in our health environment. Right now, we have Mpox.
Yeah.
And then what do we need to make sure we do at our training level to make sure that the human resources we produce have skills to tackle Mpox?
Yeah.
The first thing is to make sure we have trainings that address such challenges like public health. We as Kenya Medical Training Colleges, because of our spread, we have campuses at border points, linking with the support that we get from the Ministry of Health through the State Department for Public Health and Sanitation. We're able to provide rapid responses at our border levels. We have campuses in Busia, we have campuses in our border with Loitoktok, our border with Tanzania. We have campuses in Mandera, we have campuses in Lamu, Lodwar, and that makes it possible for us to collaborate with the ministry to give support. The fact that we are also producing sufficient human resources for health, for preventive care, then gives us the capacity to be ready. Additionally, the institution has collaborated with partners like KOICA, a South Korea agency, to make sure we heighten the capacity for training on what is called emergency medical technicians course. These are people who are supposed to help us in emergency situations. We collaborate with the Red Cross, we collaborate with St. John's, and then we are able to produce workers who can respond to accidents, fires, and be able to make sure that we are able to address emergencies in time. Right now, we are looking at being able to provide training on resuscitation for households and first aid for households, so that that maid at home can address choking of a child in the absence of a mother or a father, so that we do not lose lives in situations that we can provide skills. So we are doing that. We are piloting together with partners, and then we will be able to make sure that every household has capacity to respond to emergencies like first aid responses. We have also programmed to support what we will call first responders or bystanders. In cases of accidents, then some kind of support that is provided may actually exacerbate the condition of the patient. So that bystander, that motorcyclist needs to have basic skills on first aid. How do you evacuate a patient from an accident scene? Who among several casualties should you give your first attention? How should you remove them from the point of accident? What services are you supposed to offer before they reach a health facility?
And maybe if you may allow me, how are you working on doing that?
We are working in collaboration with KOICA, so that we're able to provide that kind of support in training local bystanders or responders in such cases. And also we are standardizing ambulance services through the kind of training we offer, so that all the ambulances are able to provide the basic support for a patient before they reach a destination for healthcare, so that we do not lose patients on the road. Yes, and we are able to do resuscitation. Anybody should be able to do resuscitation. One of the lessons we learned when we sent some of our staff to South Korea is that every person can respond to an emergency in that country. Yes, and every facility has capacity to resuscitate. In Kenya, we are far from that point, and it is something that does not require a lot of resources to achieve. And so we should be able to support our country to achieve a reasonable level of skills to enable us to avoid loss of lives that can be prevented, or complications that we can prevent.
Okay. All right. And on my last question, maybe what projections do we have regarding future health trends?
The future health training must be able to respond to emerging technologies like AI. The future health training is going to address fields that currently do not exist. And the future health landscape is going to be extremely unpredictable. And some of the specialties we have now will cease to exist. And completely new fields in health will emerge. So what then are we supposed to do as health workers? What then are we supposed to do as health trainers? We must be able to learn, and most importantly, unlearn. And again, be able to assimilate new information as quickly as possible.
All right. Dr. Kelly, I will allow you to give us your parting shot in the fewest of words as we close up.
First, have you registered for SHA? If you have not, then you need to register immediately by taking up your phone and dialing *147#. 1 for country, 47 for the number of counties we have. Please make sure you register now, today. Secondly, today we have World Hand Washing Day. Please practice frequent hand washing. How should you wash your hands? When you are from the toilet, when you are just about to cook, when you have changed diapers, or when you just arrived in the house from your daily chores. Third, Kenya Medical Training College provides opportunities for those who want to study medical courses. We have 86 campuses and 6 satellites spread across the country, and we do our admissions in September and March. We want you to look out for opportunities for training at Kenya Medical Training College, the premier medical training college in the country, East Africa and Central Africa. We want to provide the best in terms of training and support in making sure that you achieve your dreams in medical education. Yeah. Thank you.
All right. Thank you so much, Dr. Kelly Oluoch, for joining us for this particular conversation. And this is where we end this topic, which was Fit for Purpose, Healthcare Workforce. Thank you so much for staying with us. We appreciate that you took your time to get to be with us from the beginning when we started at around 6:30 a.m. to now 10 a.m. Do enjoy the rest of your viewing. My name is Vivian Degwa. Goodbye.